Hi, everyone. This is Dr. Amelia Saul, and today we are going to be talking about standards of assessment and assessment measures. So we're going to start by talking about some of the standards of assessment and evaluating instruments. So what a standard is it is a minimum level of performance determined to be acceptable. All healthcare professionals are expected to follow certain standards that apply to assessment. And so it's important for us to be able to understand what standards are in order to make sure that we are appropriately following those standards. So as I said, standards are the minimum level of performance determined to be acceptable. And so anything less than that is considered not acceptable. Often these standards are prescriptive in nature and seldom are they occupation specific. Standards associated with the assessment process originate from four main sources: regulations, voluntary, professional organizations, and site-specific or agency-specific. And so we're going to go through and kind of talk about all of these different options of potential standards that you may be following at your future workplace. So like I said, standards are prescriptive in nature. Historically, standards tended to be prescriptive in nature. Prescriptive standards state when something must happen, what is to be the scope of the action taken, how it must be carried out, and often where it must happen. An example would be the federal law for nursing homes specifically that is called OBRA, O-B-R-A, or the Omnibus Budget Reconciliation Act. Under OBRA, it requires that every resident admitted to a nursing home in the United States that accepts federal funds has an interdisciplinary assessment completed within the first 14 days of being admitted. Included in the law are also very specific timelines for reassessment. The scope of the assessment is also clearly outlined. The law requires a specific assessment to be completed. This is known as the minimum data set, or the MDS. The MDS is part of the Residential Assessment Instrument, or the RAI, a document that describes the scope of the assessment, the timing, how the results of the assessment are to be interpreted, and how the care plan is to be developed. And so there's an example in your outline as well as here that goes over the MDS. So I'm going to pull that up for you all really quick. All right, so this is the, document that you all have. So this is the MDS specifically through the Center of Medicare and Medicaid Services. And so I thought this was a helpful link for you all to be able to see more information about the assessment. When looking at standards, and especially ones that are at the federal level, they are reviewed and potentially modified every October. And so you can see some of those changes that have been made in October of 2021. And so with each year, there'll be new revisions that may be made. And so you can also see related links to some of those changes that have been made to the MDS 3.0 and the RAI manual. So all of that information can be really helpful. One thing I just wanted to show you is, what this MDS looks like. So let me open that for you. All right, so I'm just going to pick one of these. And so this is what the MDS, specifically the assessment, looks like on the inside. And so when we talk about being prescriptive in nature, you can see within both the assessment and then also in the manual, which let me see if I can find that really quick. So the manual goes over specifics about like when you should be using the assessment, how often, all of that. And then within the assessment itself, it goes into, what type of provider it is, the type of assessment that you are going to be doing, and then even into some specific questions about the resident. And so you have the link to this if you want to check it out. This is something that you may be using if you are working in a nursing home facility. All right, so when we're talking about standards, the first type of standards are called regulatory standards. And so regulatory standards are laws that are enacted by any level of government, including city, county, state, and federal. We will only be discussing federal regulations in this course because, as a general rule, it is that the professional must follow the most stringent regulatory standards, regardless of the level of government that initiated the regulation. When a therapist provides care that does not meet regulatory standards, then they are breaking the law. And so the highest level of standards would be the federal standards. And so that is why those are the ones, if nothing else, that you would make sure that you're following because they are going to be the most stringent. The next type of standards are called voluntary standards. And so voluntary standards are minimum expectations for performance, which is, in quotes, voluntary, because a facility or corporation makes the commitment to follow a set of standards promoted by a private accreditation agency. They are voluntary because a facility or corporation makes the commitment to follow a set of standards promoted by a private accreditation agency. Voluntary and reality does not always mean voluntary. If the facility does not hold the voluntary accreditation, insurance companies may be less interested in paying for services, and that facility and the consumer may avoid that facility. So within those voluntary standards, there are many different options that, as far as those standards. So there is the JCAHO, which is also known as the Joint Commission on Accreditation of Healthcare Organizations. And this specifically is accrediting organizations within hospitals and other organization health settings. CARF is the next one, or CARF, and this is the Commission on Accreditation of Rehabilitation Facilities. And so, as the name states, this is more specific to rehabilitation facilities and to promoting the insurance of minimum expectations being met as far as accreditation at those facilities. Next is the NCQA, or the National Committee for Quality Assurance, which looks at healthcare quality. There is the ACA, which is the American Correctional Association, not to be confused with the American Counseling Association, which is looking at accreditation specifically for corrections industry. So that is your prisons and jails and those sort of settings where you want to make sure that they are also meeting those appropriate standards. As a reminder, for recreational therapists, we have the ability to work in correction facilities as recreational therapists. So that may be of interest to you in the future. And then the next one is the ACA again, but this is the American Camping Association, which looks at camp owners, camp professionals, and others interested in summer camps and similar camp programs. And then lastly is the NCCHC, or the National Commission on Correctional Healthcare, looking specifically at correctional healthcare. So within the correction system of prisons, of their healthcare accreditation. And so as a reminder, although these are voluntary in nature, they are something that facilities are kind of required to have if they want to be able to accept insurance, or if they want to make sure that they get, people to come to their facility. The next is professional standards. So these are the minimum expectations for performance developed by professional organizations and are intended to guide the practice of the professionals within the discipline or area of practice. These standards are not considered to be voluntary by the governing boards of the professionals who practice within this discipline. In some cases, a professional credentials like certifications and licensures may be challenged and potentially lost if professional standards of practice are not followed. When professionals speak about professional standards, they often think about their national organizations. For example, for recreational therapy, that would be the American Therapeutic Recreation Association, also known as ATRA, or the National Therapeutic Recreation Society. However, many professionals may need to comply with multiple sets of professional standards, including standards related to specialty units. And if specific professional standards are not met, then the individual has the potential to lose their professional certification. So that could be anything from, the care that they're providing to their patients. It could be that they are making sure to renew their certification or licensure every year. There's an array of different standards within that, those ATRA standards or whatever standards you are abiding by. And then the next one is site-specific or agency-specific standards. And these are the minimum level of care that is outlined in each facility's policies and procedures manual. These site-specific standards may change frequently, often with the input of the professionals involved in implementing and writing standards of care. Site-specific standards may be more stringent than the regulatory standards, but they may never be less stringent. So they are never going to be, at a level that is less than your other regulatory standards. With talking about how they may change, and they often change, think about things like COVID-19 and how that put a lot of different changes within healthcare settings of when it was appropriate to wear masks, when it was appropriate to have visitors, the distance between patients within the facility, how often they had to be tested for COVID, or if they were required to have the vaccine, different standards that were in place, and not only for the patients, but also that was a requirement for the professionals who are working in those agencies. And so when you're thinking about, how do these standards change all of the time? Think about that. And so different policies, different things that are happening within the world will influence those standards. And something to note also when we're talking about COVID-19 is that, like I said, that their standards are going to be at the regulatory level, but never less than that. And so when we're talking about COVID-19 and the regulations that were required at the federal and or state level, those requirements covered, healthcare settings, and that they had to meet those requirements. So for example, the mask mandate. So they, at the, healthcare setting, they would not be at a less stringent standard of maybe masks are optional if they were a mask mandate at the federal or state level. So that's where that less stringent comes in. So they, maybe when the mask mandate was removed at the state level, then the healthcare settings still followed that mask mandate. That would be how they're more stringent than the federal level. With site-specific standards, they can look at things like time frame of completion of an assessment. So whether it needs to be done within 24 to 72 hours, if you have 14 days, what that amount of time looks like. The process of documenting production, and so what type of documentation is appropriate. And we'll talk about this in the coming weeks about specifics about documentation. But depending on the agency, depends on the type of documentation that's appropriate. And even things like the terminology that you can use within your documentation, or if you're going to use acronyms, which are acceptable acronyms for that facility. So things like RT may not be something that you can use as a recreational therapist because that's a acronym used by respiratory therapists. So different things like that you may need to consider. Also consider placement in chart, notation in progress notes, documenting refusal of assessment, and areas of assessment. And so all of these are site-specific standards that may need to be followed at your facility. And then also thinking about ethical standards, we talk about these a lot more in some of your other courses, but still something that you should be keeping in mind. So ethics is the belief that described behavior that are considered acceptable by a group of people. And so making the decision to use assessment tools that hold good psychometric characteristics, whether they are in-house intake tools or standardized scales, signs, or testing tools, make it a habit to question the appropriateness of the testing tools used. So does the test have clinical value, or is the result or its results have clear meaning that will benefit the clients because the meaning is known to the professionals? Expressing all the opinions that are true of the psychometric strengths and weaknesses of the test used. Using only tools for which the therapist is competent to make clinical decisions to administer and interpret. Legal and professional standards are not to apply lower standards for test administration to benefit someone else instead of the client. Regarding the rights of the client as they relate to rules of confidentiality. Retaining the ultimate responsibility for interpreting tests given, even if the test is administered, scored, and findings summarized by a computer program. All right, and then again, going kind of more into the assessment process and talking about assessments, there is assessment implementation. And so I will come back in another lecture and we'll talk about this.